Assalamu alaikum, the communication day. The scenario, you are the senior house officer in the ward and a nurse has accidentally sustained a needle stick injury while handling a patient blood sample. The nurse came to you and she's anxious and the patient is suspected to have HIV. The task is explain the situation, the next plan and steps, and address her concerns.
The name and age of the nurse is not written. So can we go without name and age?
It's okay if you face like this, you can ask in the beginning. However,
Yes.
we can assume, or you can assume this is a nurse with you, so it will be also like this.
Okay.
Anyway, they will write the name supposedly. So, Dr. Abdulmenaim, okay, let him tell you in the scenario, and you can go ahead. Okay?
Okay, no problem.
It's
Yeah.
Hello.
Mrs. Edward, 30 years old.
Mrs. Edward.
Yes.
Okay.
No. Okay, can we start?
Yeah.
Yes.
Sure. Yeah.
Hello, my name is Dr. Azhar. I'm one of the junior house officer in the ward. May I confirm your name and age, please?
It's me, Miss Edward, 30 years old.
Okay. And how are you, Miss Edward?
I'm very worried, doctor. I'm afraid that might, that just this morning I stick with this. I was trying to handle my patient and stick with this needle accidentally, and I'm very afraid, doctor, to have to caught something like HIV or anything serious, doctor. I'm very worried, actually.
Miss Edward, I'm very sorry to hear this. Today, the agenda of our meeting is that we want to discuss health issues regarding your health. And is that okay?
Okay, doctor.
Before we start, can you tell me in detail what happened to you? As you told me that you have a needle stick injury and you're very much worried about. Uh, Anything more you want to explain me?
No, doctor, this is exactly what happened, and I'm really concerned that might I'm caught this HIV or something. I'm very afraid, doctor, and this is very concern for me.
Okay, we will discuss during our consultation all these things. Before we start, I want to know what are your expectations during this meeting?
I don't know, doctor. I want to know if I'm going to have this got some disease or no. I'm very concerned about this problem, doctor.
Okay, your concern is very well valid. Before I start, I just want to ask you, before taking the sample, how many gloves you were wearing?
Actually, doctor, I think I was wearing two gloves. Yes,
Two gloves.
yes.
And during the needle stick injury, what is the size of the needle and how long it goes in your tissues?
I think it's a small. Yeah, it was small, doctor.
And after the needle stick injury, did you wash your finger or did you squeeze the blood or not?
Yes, doctor. I squeezed tightly and then I wash it by soap and water.
Okay, Miss Edward, uh, really, I'm very much worried about your health. Just I want to explain you that after needle stick injury, there is some percentage. If a person get needle stick injury, there are 0.3 chances of HIV, and there are 3% chances of person can get hepatitis C virus, and there are 30% chances of person getting hepatitis B virus. Are you with me?
Yes, doctor.
Okay. So what we will do, we will first of all we will write the incident report that this action has been occurred, and then we will start you some medications. which we call in our language is post-exposure prophylaxis for 28 days. The purpose of this medicine is that if any virus is inside your body.
Doctor, why you want to raise a incident report? Doctor, I'm afraid to lose my job if you did so.
Because when we are joining any job, and if we develop any condition, we are legally bound to inform our authority that it has happened with us, so that they can properly investigate why it happens, and how can we prevent in the future, because the higher authority, they have their own uh, process, policies, procedures and recommendations, so that it happened this time, it should not happen next time. So the benefit of this is that we can develop the some procedures and policies, so that it can be prevented for the other our health staff in future.
Okay, thank you,
Is that
doctor. Yes.
and we also want to start medicine, uh, if any virus has been entered in your body, it will prevent the replication of the virus, and then there will be very little chances to develop the disease, and we will continue it for 28 days. Is it okay with you?
No, 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 doctor. It's not okay for me because I don't want to take this medicine, doctor.
Can you tell me why?
Yes, I'm pregnant. I'm afraid that this will harm my baby.
Okay, your concern is very well valid. We will involve the female doctor, and we will involve the infectious disease doctor, and they will give you such medicine that they will not harm your baby. Now, how does it sound you?
Yeah, that's good.
Okay. Beside this, we will also do your HIV test to see whether your test is negative or positive. And if your test is positive right now, it means that the infection is, you have taken this infection before a long time. And if it is negative, then we will repeat this test after 2, 3 months. Is that
Doctor,
okay with you?
can you please do the HIV test for the patient just to be relaxed, as might be not even take this medicine right if he is negative. Can you please do it for him now?
Okay, we will try our best to contact that patient. But actually, your test is also very necessary, and I think and everything will remain confidential, and we will not deliver this information to anyone else except you. Is it okay with you?
Yes, doctor. However, can you please do the test HIV test for the patient now?
Okay, we will try our best. We will before doing the this test, we will I will take opinion from my
Okay, because
consultant.
doctor, I'm very worried. Please do the test and just tell me immediately after the result release of the patient. Okay.
You see, if we will do the test of the patient, we will not deliver this information to you, because this is a confidential, and if we will, the result will be delivered to the concerned person. It will not be delivered to you. How does it sound to you?
Okay, doctor.
Okay, are you agree for the test or not?
Yeah, yeah. I think I can do it.
Okay, in the meanwhile, I want to advise you some lifestyle changes.
Mm-hmm.
Unless we do not have the result, you will, are you married or not?
Yes, doctor.
Okay, you will use a barrier method, and you will not donate the blood, to donate the blood, and we will also involve the occupational health officer, so that he can reallocate to you in some other department, so that you cannot participate in any procedure which will affect our patients, and you should not come in the direct contact with other patients. Is that okay with you?
So, doctor, I'm going to lose my job. You want so I should
No,
stop practicing my job right now?
no, 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 you will not lose a job, because when we are joining any report and we are fulfilling the health declaration form, and that if we develop any problem, we have to inform the health authorities. So we are legally bound to the higher authority, and no, and according to the UK rules, nobody can terminate your job on this basis.
1 minute left.
Okay, thank you.
And moreover, please do not uh, share your razors and daily instruments, so that if you have infection, it should not be transferred to other unless we do not get the result. Now, is that okay with you?
Okay, so doctor, for how long should take my medicine? This post-exposure prophylaxis.
You have to take this medicine for about 28 days.
Okay, and
Okay,
then
do you have but after then we will see. After then we will see about your conditions, and we may repeat your test. If your first test is negative, then we can repeat your test after 2 or 3 months. Is that okay with you?
okay, doctor, thank you.
Okay. Do you have any other concern?
Doctor, yeah, I have one last concern, doctor. Is this what actually I'm having this concern about my pregnancy issue. So I don't want to take this medicine. Can I not just let it go and not taking this medicine?
No, uh, okay. As I told you, we will involve the female doctor, and we will involve the infectious disease doctor, and they will prescribe you such medicine which will not harm your baby. Is that okay?
Okay, thank you, thank you, doctor.
Welcome.
Okay, the time is up, but I give you some time to answer the last concern. Well done, Dr. Azhar. Let's hear a comment from Dr. Abdul Manam.
Yes.
Yeah, he did very well, very well, inshallah. He covered, I think, most of the part of the scenario. However, just one comment regarding the assurance. The surrogate come to you is very worried about her condition. At least you should offer some relief and assurance. You should assure her, please calm down. And the risk is very minimal. Especially she was wearing double gloves, and she did many things that good, that this reduce the contraction to having the disease. Yes, the percentage is point I mean 0.3, and in spite that, even until now, this suspected case of HIV, we don't have confirmatory test. So at least you should assure her and calm her, and provide some sympathy and empathy. Okay, this this some information you missed. Regarding the clinical communication skill, I think you explained the information well, and for about the scenario as general. In clinical judgment, okay, in case of you applied very well about the knowledge and principle laws, and you gave relevant management, and especially if it time scale, you mentioned that you need to just, I think, I'm not sure if you should tell her that she need, especially when she the last concern that she don't want to take the medicine. You should here you apply that we need to take. I'm so sorry to tell you that if we are not taking the medicine immediately, at least 1 to 2 hours, and the efficacy might be a little bit impaired. Regarding the
What
patient,
again? If we will not take medicine, what you said?
yeah, ideally the post exposure prophylaxis should be taken within 1 or 2 minutes, 2 hours, right? So when she raised the issue that, or her last concern, I don't want to take the medicine, you should just give some warning. If we don't take the medicine appropriately, I'm afraid that the risk of contracting or contracting the HIV might be higher. Okay.
Okay.
I think regarding the patient welfare, satisfactory, of course. And however, just some point in the you spoke about you didn't spoke about assurance. You should assure her about sympathy and empathy. I think you were a little bit lack of sympathy and empathy. Okay, there was one concern why you want to reallocate her. The patient.
Because if she will
Mhm.
comes in contact with other patient and she already have virus, then she can transmit the virus to other body. For
No,
example,
no.
she
In
is
such case,
involved in the
you
surgery.
if you back to the scenario, the patient suspected to have HIV. The patient not confirmed having HIV. And in such case, I think I'm not sure we can just even we can hear the opinion from the other doctor. But I think in such case you don't reallocate her unless she tested positive or develop reactive. I mean,
Yes, you're
what is
right.
called? Yes,
Yes, you're
yeah,
right.
you
Because also
yes,
we don't have the result yet.
exactly,
Yeah.
exactly.
So, Dr. Basu, this is a safety precaution. Maybe she has HIV before this patient. Already she has.
Yes,
I
we
think,
will wait
doctor,
for the result.
I think we will refer him to occupational health doctor. He will decide. We are not the one who decide we will relocate him or not.
Yes,
When you
at
will
least.
refer him to occupational health doctor, he may relocate you.
Yes,
Yeah,
In
at
case.
least,
it will
at
not
least.
be immediately. Yes, we can refer or we
Mhm.
can wait until the result will be released because also it will be also trauma for her. Just for suspicious, we will remove her for this department. So better to wait for the result or you refer to the occupation and they can decide with her. Okay?
But you cannot reallocate her immediately.
Okay, one more
Uh,
concern to ask me about the patient test. I do not know what was the actual answer. Okay, you should go for the first. You should go for the patient HIV test. What should be my answer?
this was perfect answer. This yes, confidentiality.
No, no,
Even the
no. We
patient. Mhm.
I told that I will consult with my consultant. Should I go for the test of the patient or not? If they will allow me, then we will do the test. And after the
No,
test, the
no,
result
no. Here,
only
here,
delay.
here you cannot. Here is a issue of confidentiality. So you inform her this. In such case, this patient, you are no longer responsible for this patient. But I don't know how to say it politely without say it politely and in perfect way. However, in such case, you can the patient or the nurse, she was no longer responsible for the patient, and she has no right to ask for this request to do the HIV test for the other patient.
So what should be our answer? Can we say that you cannot demand the test of the patient, Miss Edward? You cannot demand. So what should be the proper answer?
Miss Edward, we should
Not the
respect the. Mhm.
yeah, the consent also. We had to had consent. It's two parts this area. The consent from the patient, we can't do it without consent, and also we cannot give you the result or disclose his result.
Yes.
So instead of asking for it, we will do the test for you and will be repeated after 3 months to be sure that you didn't contract any infection or you don't have
Mhm.
infection
Mhm.
right now.
Uh,
So it's two
the,
parts, confidentiality of the
uh,
patient and the
that,
consent as a legal issue.
Yes, exactly.
Dr. Abdul Maneem, as you told, this PEP should be started within 1 and 2 hours. I think what I have read
Up
is
to
it should be
yeah, yeah, up to
72
22
hours.
hours. Up to
72 hours.
but up to 22 hours. However, ideally 1 to 2 within 1 or 2 hours.
No, no, as soon as possible within 72 hours. It's as soon as possible whenever they discover it. It's not only
Okay,
2 hours.
because
So
I thought
it's
it's ideally to take it 1 to 2 hours, or yes,
no,
as soon
no,
as
no.
possible.
It's as soon
I,
as possible. Yes, whenever you
I think
discover or
make
she
it
discover
just,
or
we should be diplomatic as soon as possible. We should not mention
yes,
as
as
soon
soon
as
as possible. Yeah.
it's
So
better.
no need to mention 72 hours, but say as soon as possible in order to make the risk of getting the infection very low. If you delay, it will be higher and higher, and we don't want
Mhm.
that. We are caring about you and so on. Okay.
Dr. Basim, can you please repeat how to respond for the issue of confidentiality for the nurse when she asked that?
Yes, it will be confidential between me and you, but some of the high authority, which is the occupational, will know
No,
about this.
I mean when she asked to ask to do a test for the patient.
Yes, we can't do it without his
Okay.
consent, and even if we do it, I'm sorry, I cannot disclose this result to you. Okay, so it will be prior to that. To do that, we will do the test for you, and we will give you the result by hand when it's released. Your result, not the patient result. Okay.
Okay. Okay. So, however, generally you did very great, and I think you will get a high mark, inshallah.
Thank you. Thank you very much.
Yeah, you did great, Dr. Azhar. I think, yeah, as all skills, you didn't miss any. But I want to correct something for Dr. Badumena and you. However, you
Yes,
are
yes.
asking about the gloves and double gloves, but it will not protect hair. It's something just to satisfy, but it's not protecting. The things will affect will be the depth and the needle size and the even the washing, the squeezing against. So don't squeeze your
Squeezing
hand.
again.
It's so this, yeah, the squeezing is harmful, and the depth, as much as the patient get the needle inside, the risk will be higher, the same as the needle size. So these are the factors
Dr.
carrying
Basu,
the risk. Yes.
one more thing I have read in the Oxford Handbook of General Practitioner that after this needle prick, you should wash your fingers under the running tap water
Yes,
within
water. Yes,
2 or 3 minutes. It's
better.
recommended there.
Yes. It's also this recommended, not alcohol rub.
Yes.
Yes, because if you squeeze, this will make a negative pressure and the blood will stuck inside the wound. So it's better to do not squeeze after the injury.
Yeah, just running water from
Yes.
the tap. Yeah.
Mm.
Okay, so I think all skills with Dr. Azhar were good,
Yes.
satisfactory also for me. The PEP or prophylaxis we mentioned as soon as possible. The instrument you said it's HCV and hepatitis C virus and hepatitis B virus. You mentioned all of these. And you can tell here like we are screening not only for HIV, some disease having risk of transmission, which are higher percentage, as you mentioned, 333, rule of 3. Point 3 for HIV, 3% for hepatitis C, and for hepatitis B, 30%.
30%.
Yeah, okay. This is my comment. I think all comments will be positive for Dr. Azhar. The source, let's read the comment. Dr. Ahmed Ali is the source of suspected for HIV. Yes, this is another issue. He is suspected one, and there was a trick about comatose patient. So the nurse will tell you, doctor, please, he's a comatose patient. Go ahead and investigate him. Do the test for him. It's not allowed as soon as the patient is not aware and consented. I cannot do this test. Okay, we can't do test unless indicated. For who? For the patient? Yes, it's for the patient, not for the nurse. If we want to do, we'll do for the patient himself. Introduction, background, circumstances, reassurance, plan, closure. Yes, thank you. Dr. Al Bashir, agree. Dr. Hassan, agree. Let the blood to flow freely. Yes, wash under running water and soap. Yes, agree. Okay, we can move to the next scenario. Or anyone has comment, please. He can say it. Dr.
Dr.
Sarah,
Basim,
Dr. Muhanna. Yes.
Salam alaikum.
Yeah.
Yes. Before to do the test for the nurse, we need to do this test for the patient before the nurse. And
No.
yes, And we need to sign a consent from the patient if it's aware or full capacity, or to need from the relative if the patient is comatose. And if the net
Yeah,
test came negative for the patients, we need to do this next test after 3 months the same, or uh, because something confused.
yeah, that's why we will not do the test for the patient, and will not, because it's already confidentiality for the patient. So no need to test it. Just proceed with the plan with the nurse. So you will do the baseline test now, and then she will take the post exposure prophylaxis. Then after 3 months, you will repeat the test, and to be sure that she is clean from infection. Okay. The
Okay.
baseline, if
Regarding the consent,
Who will
regarding the
follow up
consent,
with the nurse? Infectious department or occupational?
occupational, the occupational, they are the concerned team about the stuff.
Yes.
And who will provide the post exposure
Yeah,
prophylaxis?
this will be also by after consulting the infectious. It
Mhm.
will be prescribed by the occupational, again by occupational. The
Through the
occupational,
occupational doctor.
yes, yes,
Okay. Okay.
Dr. Basu.
yes.
Now the new guideline says for the HIV test, no
Uh-huh.
need for the written consent, only verbal consent is sufficient.
Yes, verbal, yes, also verbal, yes.
Yeah, yeah, no
Verbal,
need
no
for
need for
written
written
consent.
It's
consent.
not verbal, yes.
Yeah, that's why it was great to ask here. Are you agree for the test? You should ask this question.
Yes, yes, yes.
Mhm.
Okay. Yes. This is for legal. Okay. Any else? Anyone else? Sorry, to ask or to comment, please. It's a common scenario, and sometimes.
He asked
Yeah.
about immunization, Professor.
Sorry, about
He asked
immunization.
about immunization. Yes.
You mean HB, hepatitis B, right?
Hepatitis B, yes.
Yes, you're right. He has to. Yes, he didn't ask, but
Actually, he
he
should.
give idea.
However,
Yeah,
I give him a lot of concerns. I think that he's not having
yes,
enough. Yes.
yeah. Supposed to tell about this. Thank you, Dr. Shema. The hepatitis B as immunization for all health care provider should be done. So you have to do the test, and if it is in the therapeutic level, it's okay. If not, you have to do or to give her a booster dose. Okay, you know that, Dr. Azhar, of course. But it should be raised here.
Yes, yes.
Okay. Thank you, Dr. Shema. Anyone else? To inform her husband. So the scenario is big scenario. It's not, but Dr. Abdulmenem gave him a lot of concern. Some questions and some concern from others about the husband. Okay. So what to do? Either he will raise it, or you can give him as one sentence. Please, if you feel comfort, tell your husband. And or if she will ask you, doctor, will I tell him? That time also you have to tell that, like, please, yeah, share with him, because he's the one following with you, he's living with you, and he loves you. He should be taking care of contact and so on. Okay.
Dr.
So
Basu,
either to be raised,
about
yeah, either to be
Dr.
raised by
Basu,
the patient. Yes.
about the husband. I was attending one this course. So here the examiner asked, is it must to inform the husband that I have HIV? They told, according to the new guideline, it is not must. It is not must to tell the husband if they are using barrier method. But
Mhm.
we highly recommend that you have to that you should inform your husband so that he should take care of you. So this is
Yes,
the
this
new
is the
guideline.
point. Yeah, this is the point. Just to give him a background of the disease, he will support you, and he should be safe and careful about the contact. You should encourage. It's not a must, but you should encourage. But if she's refusing, you can tell her why. We can arrange a meeting, co-meeting with you and him, and we can deliver the information by our professional way like that. Okay. Any comment else before moving to the next scenario? Dr.
Is
Fazol.
it, oh, is it too early to inform the husband about the suspicious that she has HIV before that we
Yeah, this
confirm
is the
that
same.
she is?
Yeah, this is the same concept. Yes. Thank you, Dr. Karim. It's the same concept of reallocate here.
اه بالظبط كده.
Yes, it's
Exactly,
so
yeah.
early to say that. That's why you let her ask you this question. In case of your result being positive, we encourage you to inform him. But still,
Yes,
so
yes, yes.
early
It's
to
written
say
in the
that.
guidelines.
Yeah,
Yeah,
If
but
yeah.
it is
But
it's the
so
positive, it
concept.
is
I mean, I don't open this conversation unless she asked it about it.
Yes, exactly. Until she or
Yeah.
unless she raised it. Yeah, doctor,
Yeah.
my husband, I don't want him to know. Shall I tell him? That time only you can encourage and you can tell her you can wait until the result will be released. We don't know yet if the patient is positive or you are even positive. It might be negative for you and for the patient. And that time nothing happened. As nothing happened, you got it. So no need to encourage unless the result will be released as positive. But the concept, you know that the concept now. If they give you a scenario with positive HIV, and the patient she doesn't want to tell her husband, you have to encourage her because he will be living with her. But as a positive HIV. But in this scenario, still we are investigating. Okay. Well done, Dr. Karim. Yes, this is a good point to be raised.
Okay, thank you. Thank you.
Thank you, Dr. Karim. I think this scenario we are repeating, but still there is a lot of conflicts. But it's common one, and we should know how to do and what the steps we should follow, and what are the concerns might be raised in this scenario. Okay, so I think all scenarios we discussed today, from the introduction, the immunity baseline, and also the PIP, about the precaution, about also the reallocation. All this concern might happen, and you should ask about the circumstance, of course. As Dr. Adminan said, you have to reassure her she's anxious, and you can offer her 1 day off because of her stress. You can also offer someone to drive her home. A lot of things you can do, and you don't know what the surrogate will tell you. Sometimes the scenario like this, but you will be surprised. The surrogate will ask you different question, but all question around what we mentioned. Okay, so it will be in the same principles we mentioned already. Okay. Yeah, you can write the scenario, Dr.
Yes,
Azhar, for Dr.
I
Abdulmalik.
have posted in the group. Already I
Okay.
have posted in the group.
Okay. It's always better to inform. So if husband found later, it will cause social issue. Again, if we said after releasing the positive result from clinical
Dr.
judgment.
Ashar, I cannot see the scenario.
You see in the group.
WhatsApp group, in the WhatsApp group, I will bring it now after finishing
Sir, I
this
do not know how to
comments.
post in the
No worry,
Dr.
no
Basu.
worry.
You can
Okay,
chat.
wait. I will bring it. Wait. Then you can. Okay, wait. You can see in the chat box. Dr. Najla, I will read your comment now because always your comments are precious and helpful. Here you are. This is the scenario. You can see it now. Yeah,
Yes.
patient Miss Fatima, 72 years old female. You are the doctor in the cardiology ward. Fatima was diagnosed with ischemic heart disease and heart failure 3 years ago. Since then, she has been on digoxin, ramipril, furosemide, as well as mixed insulin, 3 unit, and 15 unit PM for the diabetes. She was admitted multiple times before due to her heart condition. Recently, she was diagnosed with renal impairment and digoxin was discontinued. Miss Fatima was admitted last night with deterioration of her kidney function. GFR was 15%. The admitting physician added digoxin to her treatment plan. 2 days later, Miss Fatima developed cardiac arrest due to bradycardia. Your task, Miss Mona, her daughter, just arrived at the hospital now. She would like to know about what happened to her mother. You are you are obligated to meet her and answer her concern. Yes, I remember this scenario. Okay, be ready, Dr. Abnem. I will give you 2 minutes. I will finish the comments here in the chat box. Dr. Najla wrote, from clinical judgment point of view, we will advise the nurse to practice safe sex until we get your result. Exactly. And don't share your instrument or private tools. These the most important, and you must advise about these things. Okay, can please repeat PEP? PEP means post-exposure prophylaxis, and it will be prescribed in the best interest for you as soon as possible. You have to start it for 28 days. And please, if you find any side effects, do not stop this medication for any reason unless you have medical advice. So it will protect you and it will make the risk of contracting the virus very low. Is it harmful for the baby? We have safe drugs or safe medication which can be prescribed in the best interest for your pregnancy. No worries about that. Okay, along with the occupational health team and the infectious disease team. This is how to answer this PEP point or PEP as a concern. Post-exposure prophylaxis. I mean protocol of post-exposure prophylaxis. You mean the medication, right? Two or three or what are they? I cannot remember. And yeah, I cannot say names because whenever I will memorize the names of hearts, antiretroviral medication, I always forget them. And no need to mention them in the exam. Totally. And the surrogate will not ask you what the name. And if she asks about the name, simply tell her it will be prescribed by our team or occupational team or infectious disease team. So it's not your task to know the medication. You are not the infectious disease. You are not the occupational health team. Okay, just know what you have to give as a group of medication, not as a special or specific medication or by name. And no one can ask you because it's not your task. If you want to learn about them, you can read, and again, you will forget them. I never really memorize and also remember the names.
You're right. You're right. I also tried, but never remember them.
Yes, I remember only Zidovudine. This is for IV during delivery, and it's safe also medication for the baby. I mean, yeah. One more point, very important. What about breastfeeding? If she told you, doctor, I am breastfeeding the baby, what advice you can give?
Are you asking me?
Anyone? Okay, Dr. Azhar, you can mention.
Yes. Yes, we will advise and give.
Is it safe to give breastfeeding?
I think
And
will be through MDT, including a child doctor or a woman doctor, and to choose the safe
No, this
antiviral.
is no. It's not preferred. If of course, if she has the viral, yes, it's not
Yeah,
preferred.
I'm talking if she is positive.
Yeah, if she's positive, no breastfeeding, bottle feeding only.
should not. It
Ah,
should not be.
okay. Okay.
Yes. But other virus she can. The HIV cannot be.
Mhm.
No breastfeeding in HIV. No breastfeeding.
Yeah. It's not advisable. Yes, not advisable. In HIV, no breastfeeding. Exactly. Okay. If she raised the concern that if source negative for HIV, can I stop PEP? How it will get the result? The result will be, or the test will be done after
You have to
2 to 3.
3 months. Three
No,
months
no,
after.
3 months, yeah. But the test will do now for the previous condition. It will not be right now.
Yes, she will do the after if she took the post-exposure prophylaxis, she will do the test after 45 days of completing the.
Yes. So it will the result sent now for baseline HIV status of the patient. It's not for the current needle stick because the antibodies takes time until will be
2 weeks. 2 weeks.
released. Or
Antibiotics
yeah,
take 2 weeks to develop.
yes,
Yes,
it
after
will take
45
time.
days of completing the PEP, she will repeat the HIV testing.
N-
Exactly.
However, if we want the result immediately, we can go for the P24 antigen. P24 antigen. We can go.
B24 antigen. It's I think it's not advisable, Dr. Sarah, or they are
No,
doing
no, they
it.
will do HIV antigen antibody. It will be positive. The antigen antibody after 45 days. If she has, after 45 days, she it will be positive. So no need for other test. We do the HIV antigen antibody.
Dr. Basam, I will tell you this the guideline is if ELISA, we are doing ELISA test. If ELISA test is positive, then we will go for the quantitative PCR.
Yes.
Quantitative PCR for viral load and confirmation. And if ELISA test is negative, if ELISA test is negative, then we can go for the qualitative PCR.
Yes. No P24 anymore, the antigen.
Yes, 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 yes.
They are doing only to any patient with suspected HIV. They do 2 tests, and then if it both negative, so it's not HIV.
Yes, yes,
And then if it's confirmed positive, so then we'll go to the viral load and CD4 count and all the HIV workup
yes. Viral load and PCR,
and CD4 count. Yes.
CD4 count. And if the patient develop opportunistic infections, in
Yes,
that
from the
case,
beginning.
ELISA will be positive or not?
So we will do the HIV viral load CD4 count. If CD4 count less than 200, we'll do the opportunistic infection, which is beta D glucan, galactomannan, cryptococcal antigen, toxoplasma. We'll proceed with that. If the CD4 count more than 200, so no need to do the test for opportunistic infection.
Yes, yes. If less than 200, we will go for the CD4 count. Because of opportunistic infection, they will never develop before 2 years. Before 2 years, and during this period, if this virus has been present, antibodies will be developed. So, if the patient develop opportunistic infection, definitely we will go for the PCR and the CD4 count.
Yes, because opportunistic infection are not developed only if the CD4 count less than 200. If the
Yes, yes,
CD4 count more than 200, it's unlikely if the patient has chest infection, unlikely that he has PCP, unlikely that he has opportunistic infection.
thank you, thank
Yes.
you.
Thank you, Dr. Sarah.
Dr. Bassem, just to add one sentence.
Mhm.
It's just red flag. Educate her about HIV seroconversion syndrome,
Yes, perfect.
and if she got any fever, rash, any lymphadenopathy, she should visit the clinic.
Yes, yes, you are right. Fever, rash, sore throat, flu, like these symptoms,
Yeah,
you
yeah.
you immediately have to inform us. Okay, very good.
Just to educate her because this is the first syndrome in HIV. So three
Yes.
syndromes in HIV. This HIV seroconversions, and after starting of treatment, immune reconstitutional syndrome, then in advanced stage HIV wasting syndrome. So here HIV seroconversion is very eminent if she got the infection, if she got the infection from the patient. So she will not have symptoms till 3 months, I think. Then she'll start to be febrile with lymphadenopathy,
Yes.
rash. Yeah.
Yes.
So just just patient education.
Well
I
done.
think the scenario was very, very big. In 10 minutes, we cannot cover all these.
Yeah, you have to touch most of these
But
things
but
by one sentence.
the rule is address the patient concern. So if the patient didn't raise the
Yes.
concern, fine, you are fine.
Yeah. You can try to cover all, most of these points, but depend on her concern better, because if you waste time to explain things she doesn't need it, you will find another different concern at the end and you will be in trouble. I didn't give her all the address about her concern. So better to wait for her questions, question after question. So don't talk more here. Try to be listener as much as you can. Okay.
Okay.
Thank you, Dr. Azar, Dr. Ahmed. Someone, Dr. Hatim, yes, he shared the name of the medication. It's called Truveda, and 2 tablets of riltegravir.
Raltegravir. Truvada and Raltegravir.
Raltegravir.
Truvada is
Okay.
tenofovir and lamivudine. It will take 1 tablet from Truvada. It's 2
Yeah.
medication. Okay. And Raltegravir, he will take 2 tablets from it.
Yeah. Okay.
Raltegravir 600, he will take 1,200. But I think in the exam he won't say this. And the
Yeah. Yes.
pre-exposure, it's only for Truvada. The pre-exposure prophylaxis, only Truvada. Okay. But the post-exposure prophylaxis is Truvada with Raltegravir.
Prophylaxis only Truvada.
Pre-exposure, this pre-exposure prophylaxis, in sexual worker and sexually active people with male
Okay. The
partners,
pre-exposure.
so
Okay.
and trans male and gay, we advise them to especially the gays, okay, and the sexual worker. We
Uh-huh.
advise them to have the pre-exposure prophylaxis. The pre-exposure prophylaxis is only Truvada. It can giving daily, or it can giving event based. Event based, it's mean to have to you will have after for only before having sex and for 2 days only after having sex. This is for people who have less frequent sexual intercourse. But if the patient is highly sexually active or one is working as sexual worker, so she will do the daily pre-exposure prophylaxis. But this is too much for you. Only
Yeah.
you
Yeah. Too
you know
much
the pre-exposure
details.
prophylaxis. There is something called pre-exposure prophylaxis and post.
And post-exposure. Yes. Okay. We know the name now. At the end of the session, I will ask uh, someone to give me the name because it will be again forgotten. Let's start the second scenario. Okay, ready? I will reset the timer. Then you can start, Dr. Abdul.
Hello.
Yes.
Hello.
Yes. Yes.
My name is Dr. Ahmed, one of treating doctor in the clinic today. May I confirm that you are Miss Sarah, Miss Mona, the daughter of Miss Fatima?
Yes.
Um, Miss Mona, we are here today to discuss and to update you about your mother about your mother situation. Is it okay with you?
Okay.
Just to be in the same way, can you tell me how much you know about your mother's health situation?
Doctor, I know that my mother, she was having multiple health issues and she was taking many medicines, some medicines and some insulin, and she was taking it from for many years. And 2 days before her health deteriorates, and she was brought in your hospital.
Mm-hmm.
And today when I came, um, but somebody told me did not a good news. I do not know. Uh, it's not a good news, but I cannot believe what happened with my mother. Please, doctor, can you tell me exactly what happened with my mother?
Okay, Miss Muna, firstly, I'm sorry about what happened to your mother, and please accept my deepest condolence in your mother's loss. And she was very precious to us.
Doctor, what do you mean?
Well,
What do you mean? Why you are saying like this? That accept my condolences. Why you are saying like this?
well, I would, I'm so sorry to tell you that I have bad news for today.
What?
Well, as you know, that your mother came to the hospital, and after we tried to manage her, I'm so sorry to tell you that we give mistakenly the medicine that we stopped. The doctor mistakenly give it to her again, and I'm so sorry to tell you that your mother is passed away.
Oh, doctor, what are you talking? I cannot believe. Because my mother was all right and she was having multiple health issues. But I cannot believe what happened to my mother. You are saying now she is no more in this world? Oof.
I'm so sorry about what happened, Miss Muna, and anyone. This is a great loss for all of us, and this was shocking for all of us. And please accept my deepest condolence for your mother loss.
Okay, doctor, can you tell me why this happened to my mother?
Well, do you want some tissues or some water?
Okay, doctor, you can continue. And please tell
Okay.
me what happened with my mother.
So when your mother came to the hospital with this complex background, and I'm afraid that I have another something I want to explain here. Um, well, in the previous admission that your mother she has taken one medicine for her heart problem called Digoxin. This medicine was stopped last visit. However, when she come again to the hospital, mistakenly the doctor gave her again. I admit this is an error. This should not be happened. I'm sincerely apologize about what happened on behalf of me and all entire team. This should not happen, Miss Muna.
Doctor, tell me the name of that doctor who started this medicine. My mom told me the doctor has started one medicine. He is not a doctor. He doesn't know why he started this medicine to my mother. I think he is a killer of my mom.
I highly appreciate your concern, and I can see how this will be shock for you. However, Miss Muna, we are here we work as a team, and since this mistake has happened, we all of us responsible for this mistake. And regarding your second concern, um, until now we are not sure about what happened exactly, what is the cause of the exact cause of death. However, because your mother has a complex medical background, that is until now we are not sure about the exact cause of death. And I would like to assure you that since this happened, that means there is something procedurally wrong, and immediately that we informed our seniors, and we informed the supervised nurse and general and ward manager, and the incident report was raised, and this responsible for risk management team, they are team responsible for investigation such situation, how why this happened, and to prevent this happen in the future again. I hope you understand this point, Ms. Mona.
Doctor, you are trying to save your doctor. I will not leave that doctor. I want to complain against that doctor. Please guide me where I should complain against him.
Mhm, mhm. I can understand your feeling, and I'm not in the position to defend my colleague. However, and yes, this is your right. If you want to raise a complaint, this is your full right, and I will help you in this. However, if you give me a chance to explain the situation here, you might see might see the situation from the other perspective. If you allow me.
Okay, you can explain me.
Okay. So as this error has happened, this risk management team, they are responsible and to investigate the error, why it's happened, and what is happened, why it's happened, and they will after this investigation will finish, the result of this investigation will be discussed in a meeting, and they will investigate this, and they will discuss the result, and to prevent this happen in the future again. Ms. Mona, do you have an idea what should be happen next to prepare for funeral?
Just give me a death certificate. I want death certificate from you. Just give me death certificate.
Okay. Since this happened and the exact cause is not known yet, the only one responsible for giving this certificate is the coroner. So we need to refer it to the coroner, who is the only one authorized and should be referred by law to the coroner. And he's after that, his independent office is responsible to study the case, and he will decide if he can issue the death certificate or she needs to go for postmortem examination. I mean, the examining of the body after death.
Okay, so
I hope you
doctor,
understand this
tell me the
point.
reason. Tell me the reason. This medicine killed my mother, or there are some other reason?
2 minutes
I
left.
highly appreciate concern, Ms. Muna. Well, actually, because of your mother has a complex medical background, the possibility, to be honest, we here we are ethically bound to be open and honest with, to tell you about the clear situation. However, one of the possibility could be behind this medicine at the same time, because your mother has a complex medical background, might be the cause of this due to any one of the diseases. I hope you understand this point, Ms. Mona.
Yes, yes, yes. Yes, I go.
Well, do you have any other concern for me?
When they will give me certificate? Because I have to arrangement for the funeral.
Okay. We here we are aware about your situation and about your feeling, and immediately we will refer to the kid to the coroner, and who will decide if he can. He's the only one that's responsible for releasing this certificate, and we are aware that you are passing through a difficult time, so we will try to do it as soon as possible. However, the first of all, we need to refer it to the coroner, and then he will decide if he will give the death certificate or need to do for postmortem examination.
Okay, okay. Thank you, doctor.
Okay. Do you have any other concern for me?
No.
So again, please accept my deepest condolence, and if you need any support from our side, we are here for you.
Okay, time is up.
Thank you very much.
Yeah, Dr. Azhar, you can.
Okay, mashallah, Dr. Abdul Mani, he did very well, very well. Almost he covered all the points. His way of communications, empathy, sympathy was very nice, and he involved the coroner, and he also raised the incident report. And I think he just forget when you said that I want to raise a complaint. I think he did not give me the name of the Pauls. I think he forget. I think otherwise he did very good. Everything was very fine. I don't have any comment, Dr. Basam. Mashallah. You can give some comment.
Yeah, so regarding skills, you asked about clinical communication. Just give him score of satisfactory, borderline, unsatisfactory.
Yes.
So you give him satisfactory for clinical
Yes, yes,
communication.
yes, yes.
Okay. The also clinical judgment. He
Yes,
deal with the
also,
scenario well,
also satisfactory.
and the welfare and concern as well, right?
Concern.
Okay,
Everything
thank
right.
you. Yeah, thank you, Dr. Azhar. A very nice scenario, and it's a recent scenario. Yes, I will read now the comments. It's okay to say I don't know when she asked who gave her the mom medication. For me, I don't think when you say I don't know will be good answer. If you say like this to the surrogate and he's angry, he want to know who that person. Once you say I don't know means that you are escaping from the answer, and I think he might be irritated. Who is whosoever the advice or the opinion from, I think what makes sense I should follow. If you say I don't know, the surrogate will be angry and irritated. For me, I will say as we are using to say, sorry, it's a team mistake, and we are here working as a team work, and this is our fault, all of us, and on behalf of all the team, we apologize. This, I think, the best answer. But if you mention I don't know, means that you are trying to escape from the answer or from the telling the name, right? I think so. What's your opinions, Dr. Azhar? What do you think about this answer? If you say I don't know, is it wise to say I don't know?
No, 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 I don't think so. I don't agree with this.
There is accountability. So we are on
Yes,
behalf of the medical team. We express our sincere apologies.
yes, yes.
There is
Yeah,
nothing.
how can I say I do not know that what happened to your mother and who gave this medicine like
Even
this?
if you don't know, you should not say that. You will apologize,
Yes,
regardless
yes,
who done the mistake. So this is what's called accountability of the medical team. So you are
yes, yes,
accountable, doctor. Show your apologies, regardless who done the mistake. We are as a medical team apologizing for you.
yes,
That's
yes.
all. And just finish it.
We all are working as a
Yeah,
medical,
yeah, I
as a
agree
one.
for this also.
And Dr. Abdul Munim, you can also add this that we will also discuss this in monthly morbidity and mortality meeting and monthly consultant meeting and weekly meeting. You can add two, 3 lines also. It will be have a good impression. Mashallah, you did very well. Just a little bit you can, if you add, it will be good for you.
I
Yes,
want to ask
also,
a question.
Okay, thank you so much.
yeah, Dr. Shema.
From where we know that this is a coronal postmortem? The reason behind the death is already known. She is
No,
taking a diet and she had the bradycardia.
No,
yeah,
no, no.
bradycardia because of digoxin,
Yes, and we already
and
know.
patient had renal failure,
Yes, we
so
already
shouldn't
know.
be shouldn't be prescribed.
Yes, this is error. Yes, this is error, and we know the
Yes.
cause of this. Why we will do a coronal?
Also to know if the kidneys or the heart has already pathology. So it will be like protecting your stuff as a decision, and or confirming this is because of the digestion.
where's the scenario يعني ايه اللي في السيناريو قال لي ان انا هعمل كورونا مفيش
Because
حل
I think
It's not
because
written.
of
It's
multiple comorbidities,
not
she has
written and
a
it is
heart problem. You cannot just assume that this because of bradycardia, and
Yes, yes,
might be due to arrhythmia
is
for any causes because she already has a history of ischemic heart disease and history of heart failure. And I think ejection fraction was written in the exam in the scenario. So there are many possibilities for the bradycardia. You cannot guarantee 100% because of this digoxin.
Yes.
Just to
So this is
confirm,
Coronal postmortem should be said to me. Your task is to talk about coronal postmortem.
the problem is the scenario. The
In
scenario,
only or error only. If you
yeah,
think that
yeah. No. The scenario written like that, and the feedbacks came like that, and it was like this. So we are stick to the scenario as feedback. You got it?
Yes, the feedback came like this is not even in the description of the scenario. It wasn't written as a medical error. The in the scenario written as a food duty contour. I think this kind a new category of scenarios. But even the examiner didn't write it is a medical error scenario in the
yes,
feedback.
yes.
You got it,
So
Dr. Shaima?
the
Yes.
exact cause.
feedback, it was written in the feedback. It was written. It is a coronal postmortem. I
But
asked.
you see, doctor, you see, if we do not know the exact cause of the death, in that case, we have to involve the coroner to reach the exact cause of death. We do not know the exact whether it is because of digestion or patient already has multiple health issues. It may be due to kidney problem, it may be due to heart problem, it may be due to digestion, but we do not know. They have their own way of investigation. They can check the medical record, they can take the blood sample or scans, or they can check some piece of from the patient dead body to confirm the diagnosis. So when it is suspicious, we have to involve the coroner. That's why we
Yes,
do not know the exact cause.
yes, I agree. I wanted to I ask about is this mentioned in the feedback? This is a scenario of post-mortem coronal. I ask only.
I do not know about this, but it was written duty of the
I'm not
candor.
sure 100%. However, the candidate who do not mention the coroner, I think they didn't pass the station.
Thank you.
Assalamualaikum.
But I'm not sure if the cost at the same time I'm not sure if he failed because of other mistake or because he didn't refer to the coroner.
Thank you.
Assalamualaikum. Shall I give an opinion regarding
Alaikum
this?
salam. Yes, please go.
Okay, I'm a judicial medical officer for many years, so I know about this case. So I will tell you what is right to be done. So, in this case, the relatives they accuse the hospital, and the hospital they don't want to tell this is an overdose, right? So they will tell that it can be other causes also. So the cause of death is in dispute. So definitely, if you send to the coroner will do the postmortem. There is he will, but you don't have to tell that. You just have to tell that you will refer to the coroner. The coroner will decide on the whether he will issue the death certificate or do the postmortem. You just have to tell that.
Aha, okay.
But
So you are
in real
referring
life,
only to have opinion. Yeah, just to
yeah,
have opinion from them, but they will not proceed for this.
yeah, because the coroner in this situation, medical error, definitely coroner will do the postmortem because there is no because he can't give a cause of death, right? He's a person who is a legal
Yes.
person. He's not a medical
Yeah,
person.
yeah.
So he will know he will just look at what has went wrong.
Yeah. So
So
we are
he will
asked.
investigate.
Yeah, we are just taking opinion from them, and they are the legal office
They are the
concern.
no, because the
Yes.
hospital is finished. The hospital's responsibilities are finished. Now the death is happened. So what the doctor has to do, we are going to refer to the coroner. The coroner will decide. The coroner will give you the cause of death, and if necessary, he will do the postmortem. You have to tell that also. You can't say that you will
Yeah.
not do postmortem, and then when the coroner do the postmortem, there will be a conflict. So, as a doctor, what you have to tell is, we don't know what is the cause of death. We are unable to give you the cause of death. So, what we are going to do is, we are going to refer you to the coroner. He will be the person who gives the cause of death, and he might decide whether postmortem is necessary or not. But in real case, definitely the coroner will go for the postmortem because it's a dispute of cause of death. You will never know a cause of death if a doctor cannot say what is the cause of death, then coroner cannot. He has to get opinion from a judicial medical officer to do the postmortem and look at the blood level and look at whether the heart really stopped. He will the one who tell the coroner this is the cause of death. This is the real life scenario.
Yeah,
Because
yeah.
even like you said, the coroner will not do blood test or take tissues, because coroner is not a medical person. If coroner will give an inquest to judicial medical officer to do the postmortem, a medical
Yeah,
officer.
a hundred
That is the real
percent
scenario.
agree. Yeah, yeah, I agree with you. Also written in the post, yeah, any unexpected death within 48 hours, it's a coroner case.
Yes.
Yes, I agree for
So
this.
you don't have to talk too much. You just have to like the candidate who did the
Yes,
he did the right thing. We are going to refer you to the coroner. The coroner might decide whether he will be the one who is giving the death certificate, and he will decide whether postmortem is necessary or not. So your job is finished afterwards. I hope this clarified.
yeah, 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 very clear. Thank you so much. Yes, it's
Yeah.
clear.
Okay. No. Thank you.
Yeah,
Thank you.
it's as the usual indication for coroner, any unexpected death within 48
Yes. Yes.
hours of admission. And this one
Yes.
is one of these cases. Yes, you're right.
And
Yes, thank you.
any death in emergency also, they will do the postmortem, because a person come to the emergency unit within few hours arrested. No
Exactly.
doctor
Yes.
will give cause of death,
Yeah, and
because
also
yes,
death on table while surgery or procedure. This is the
yes.
same indicator.
And
Yes.
medical error is like most probably medical error will go for postmortem. You know why? The hospital will tell no, he has comorbidities. There are many causes of death. This might be the reason. This because they want to safeguard themselves, and the relatives they will say no, you are the responsible person. No, the doctor killed
Yes.
me. So it is a conflict. So coroner will not just give away saying that this is what this. He will go for postmortem. This is the real life
Mhm.
situation I'm saying.
Yes. 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 Thank you, Dr.
Okay.
Fazlur Rahman. Thank you so much.
Okay.
Appreciate it.
Okay.
Uh,
السلام عليكم دكتور باسم. السلام عليكم
Salam.
دكتور باسم.
Yes.
Mention for
Yes.
we did for this patient
Yeah. Go ahead.
risk failed, because there is no intervention did for this patient after cardiac arrest, and there is no clear where this patient pass away or cardiac arrest. Cardiac arrest may be returned after resuscitation or something like that to return ROSC.
No. No.
We need, yes, we need to no intervention to embassy and sympathy for the relative. We did for this patient resuscitation, and unfortunately pass away after do for him help or something like that. We need to mention for the relative, and this yes, it can be embassy and sympathy for the patient, because we not let the patient pass away in peace like this.
But it's a scenario clear. It's not written, but yeah, the scenario clear that the patient is dead.
Cardiac arrest it mentions cardiac arrest because bradycardia.
But if recover, they will mention recover. But cardiac arrest due to bradycardia means cardiac arrest. Then no risk. If there is risk, they will write there is risk. You got it?
There is no mention any intervention when the patient
Anyway,
cardiac arrest.
you know, sometimes the scenarios from exam is or are lacking of sentences. But in the exam, everything will be clear. No worries about that. They are writing the scenario from A to Z until you cannot even finish the lines because it's a lot of details. So no worries about that, okay? I think this scenario, yes, there is a lack of sentence that patient died. And also, you remind me to say to Dr. Adnan, whenever you say to a relative, patient died, you say patient died. Yeah, don't say passed away or he's not with us anymore. Just say, I'm sorry for your loss and your father or your mother dead already or she just died or she's dead. Don't say she passed away. Okay? This is
Yes.
clear from all books. Okay?
Okay, but there is no embassy and sympathy for the patient, and there is no intervention and no help to help the patient when the cardiac arrest happened.
Yeah, you mean from Dr. Abdul
We
Menam's
need to
side,
mention
you need
just
him to be more sympathetic.
I need to mention if this patient is diet. We
Yes,
need
yes.
to say that there is something intervention done for this patient because there is
But
it
not
make
nothing
the
written.
relative.
Dr. Abdurrahman, don't mention something
Yes,
which is
I
not written.
yes yes. I asked, can I mention that? And there is no written. Also, diet is not written, and there is no written regarding interventions. So
Okay.
can I mention for the relative we did something like resuscitation for your mother or father, and unfortunately pass away, died or
Yeah,
no? There is no
it's
clear
not
word
written.
regarding it,
Yeah,
and
yeah.
this.
If not written, don't mention. In this scenario specifically, don't mention because it's not written. But again, in the exam, the scenario will be full of sentences and all details will be there. I think this scenario is lacking of words and sentences. It should be mentioned if did or not. If it should be mentioned if CPR done or not. No response. All these things must be written. But I think this scenario is lacking of something. I mean sentences. So you're right. I agree with you. But in the exam, no worries. It will be perfect and complete scenario with all details. Okay.
Yes, yes.
But
And
I
if the
agree with
relative
you. It's not written. And if not written, don't mention. This is the lesson from your question. If something not written, don't mention it. So don't say we did CPR and he didn't respond because it's not written. Just tell him your father died. What's it's written, you have to mention. It's not written here, but
because
it seems he's died. Yes, okay, he did,
yes, died
or
without
he's
any without any support, so that it
without
cannot be
any
help us.
details.
When
Yes, you didn't do or you didn't add because you didn't read it. So your father died.
yes, because this patient is a cardiac issue should be resuscitated. Yeah, it should be mentioned in
No,
the
no, no, no,
scenario.
no, no. Don't mention something which is not written.
Yes, yes, I know
Stick to
that,
the
Dr.
scenario.
Basim. Lakin, yes, because there is no clear word mentioned in this scenario, diet is
Okay,
unfortunately.
okay, but this is the meaning of the scenario. He did, okay, or he's dead, or he died. So it's not written clear in this scenario, but in the exam, I think it was written. I
Yes,
didn't
yes, it's
attend
clear,
this
no problem.
scenario.
No problem. Yes, yes, yes.
Okay, thank you.
Okay, thank
Thank
you.
you, Dr. Abdulrahman. I think it's clear. Yeah, thank you. Again, yeah, well done, well done. No, do I need to offer post-mortem? This will be hospital post. No, it will be coroner. It's not explained death, unexpected death. And if the family also raise the issue, it will be also by coroner. It's not by the mortem. If the family said or accused the hospital, as Dr. Fazlur Rahman said, yeah, that's why we are raising this issue to coroner, and they will investigate to know what happened exactly with your father, and they will decide either to go further or no, to know what happened exactly. Okay, for pals first to try to convince to change the prescriptive as done and lightly touch pulse, but if surrogate still insists, then explain pulse details. Yes, I agree, Dr. Ahsan. But if he insists, not offer from the first word, yes, as you said. But in this scenario, wait for this because it's one of the tasks to refer the family for because this is error, and definitely they will complain. So don't convince him more. Once he said, I want to complain, yes, I can guide you. Don't waste time to convince them because this is a life which is lost, her mother or his father or her father or whosoever. So it's something fatal mistake. They will complain by anyway. So from first question, doctor, I want to complain. Yes, it's your right. I will refer you. Don't try to convince because this is a death and major medical mistake. Only team is yes. I agree. I agree with all of you. I get confused yesterday. Yeah, I think I don't know. It's not a wise answer. How will I start? Should I start with condolences? Yes, of course. I'm here to support you. I have no good news for you, or I have concerning news. I'm sorry to be the one delivering this news. like that. No need to postpartum here unless family insists to know. We can measure digoxin level in the body in postmortem. This is not our decision. Don't suggest. This is coroner task or coroner job. Detect the level to do snip test, to do whatever. This is their job, not our job. We should stick to the scenario exactly, Dr. Ibrahim. This will save our colleague as we are a team. Exactly. In addition to fulfill the task, any unexpected death, as I mentioned, yes, within 48 hours, you can refer to the coroner. This is a new trend in basis by Dr. Al Bashir. Applied duty of candor if complication of procedure or severe devastating side effect. Medicine just apologize once and apply duty of candor. Not apologize once, apologize all the scenario. It's not only once. This is a major mistake. You have to apologize every now and then. I'm so sorry for your loss. On behalf of the team, I apologize. Again, accept our apology. Make it like at least thrice. Okay? It's a major mistake, fatal mistake. The patient lost his life. Here on this scenario, despite the patient is fragile, digoxin should not be given to him. So clear side effect. This is not uncertainty. Go for duty of candor directly. Yes, about corona. Here, don't offer postpartum unless the family ask about the exact cause. But in scenario, it's given as death happened because of digoxin. Yes, that's why we have to refer to coroner. I think it's clear now the scenario. Coroner, then coroner, then coroner. Whenever you have unexpected death, within 48 hours of admission. Okay, even you have the cause of a possible cause of arrest, you have to refer. They should investigate what happened with him, why he had or she had a death on admission. Okay, I think this is more than enough for today's session. Two nice scenarios and two well performance by Dr. Abdullah and Dr. Azhar. Sorry for being lengthy talking today. It was very rich of information scenarios. I hope all of you get the benefit from this. Any question before ending the session? Okay.
Thank you very
Thank
much.
you, Dr. Amin and Dr. Azhar, and all of the candidates participate today with us with sharing information and comment and posts. Wish you the best. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.